sometimes you don't realize how poor you felt until you start to feel better and you come out on the other side. So that was very true for me. I felt terrible. I mean, I was in my early 20s and could truly lay on the floor and just fall asleep if I wanted to. Wow. It was crippling chronic fatigue that, again, I thought was just typical because I was a woman and I was busy.
In today's interview, I had the pleasure of interviewing Alisha Knicely, a registered dietitian and integrative and functional practitioner with over 10 years of experience, specializing in hypothyroid conditions. As a Hashimoto's warrior herself, Alisha intimately understands the daily challenges and triumphs of living with and effectively managing this common yet complex condition. Alisha's approach is rooted in a comprehensive and holistic philosophy, emphasizing the transformative impact of personalized nutrition, lifestyle modifications, and evidence-based strategies to support endocrine and autoimmune health. Beyond her professional expertise, Alisha is a wife and mom who loves spending time outdoors, whipping up healthy desserts, and expressing her creativity through painting. She cherishes connecting with others who share a passion for wellness, holistic living, and entrepreneurship. Being a part of and serving the thyroid health community is more than a career for Alisha. It's a calling that brings her immense joy and fulfillment. I hope you enjoyed today's interview.
Well, I'm joined today by Alisha. Alisha, I'm so grateful to you for your time. You're a thyroid expert, which we'll soon learn, I'm sure. And because there's such a massive overlap between thyroid dysfunction and endometriosis and the implications of that, I really wanted to find somebody to talk to on this topic. So I thought it would be great to just start off, if you could tell our listeners who you are and what makes you a great person to talk to on this connection between thyroid function and endometriosis.
Yeah, thank you, Cindy, for having me. I'm really excited for this conversation too. So, yes, my name is Alisha. I am a registered dietitian, and I myself live with Hashimoto's and hypothyroidism. So, a little bit about my background and story. 10 years ago, I started my career as a clinical dietitian and really enjoyed that side of acute care. I did that for a few years, but then realized I had a passion for outpatient and more of a wellness long-term relationship with my patients. So I transitioned to a wellness center and became the staff dietitian there. And the owner, she was the naturopathic doctor. She taught me so much. I learned a lot as far as the functional approach to chronic diseases, which I found just absolutely fascinating. And it was actually during that time that I was diagnosed with my own autoimmune condition. And it really did catch me by surprise because I thought I was the picture of health. I was doing all the healthy things, eating well, active, and I was missing so many signs and signals from my own body that I was in crisis mode with what was going on with my health. And it was just a routine checkup with my primary, and all of my thyroid labs were in the extreme abnormal range, like completely off range. My thyroid antibodies, my TSH, my T4, T3 levels. And my doctor was actually very surprised. She was like, I don't even know how you're getting out of bed in the morning. And I was like, I don't know either. This is just how I felt. The body's very good at compensating. I now know that, and very good at adapting when it needs to. And then through that reality, that kind of eye-opening moment, I did take some time to, and hindsight is 2020. I looked back the past 5-10 years, and I had this clarity of, oh, okay, so a lot of these things that I dealt with were not normal, but I normalized them, as I feel a lot of women do. Especially the time of my life, I was a busy college student. I had multiple jobs, a social life. I was very stressed out, so my extreme fatigue and inflammation, anxiety, all of these things I just attributed to what was going on in my life at the time, not the fact that my body physically and mentally was suffering. And so then it was kind of nice to have, after the shock of the diagnosis, it was nice to have an explanation and that there was hope I could actually feel better. I just didn't know how. And most of my conventional doctors, my endocrinologists, they had very little support, answers, guidance for me, which I found very frustrating because I was only offered medication. I was only offered to check my labs. And I knew as a dietitian there was so much more, and dipping my toes into the functional realm and root cause approach, there was so much more we could do. I hadn't learned what that was quite yet, specifically for Hashimoto's and autoimmunity to that extent. So then that sent me on a whole path of, yes, yeah, I did. And I really enjoy learning. So I read the blogs, I read the books, I searched social media, I read articles and studies, and then I became trained myself. I went down that route of, okay, I want to become a functional practitioner. I want to learn about integrative medicine, a root cause approach. I will use myself as a guinea pig, which I did. And over the years, I was able to, piece by piece, address my specific areas of imbalance in my body, what my body personally needed support with. And it was really cool to see the healing happen. And sometimes you don't realize how poor you felt until you start to feel better and you come out on the other side. So that was very true for me. I felt terrible. I was in my early 20s and could truly lay on the floor and just fall asleep if I wanted to. Wow. It was crippling chronic fatigue that, again, I thought was just typical because I was a woman and I was busy. So that passion to help myself definitely translated to the clients I was working with, my patients. And then I decided, well, I only want to serve this community. I exclusively want to work with thyroid patients. I feel like they're a very underserved patient population because conventional medicine views it as, oh, this is a simple fix. We just need to replace thyroid hormones and you're good. There's nothing we need to do to actually address the autoimmune aspect, the immune dysfunction, the inflammation. And that's where a lot of patients, and I'm sure you can relate to this, get stuck because their lab work might look normal, but they feel anything but normal, and then they're not given any tools to reverse their symptoms or address them at the root level. Yeah. So that's, for the past 6 years now, I've been, social media, my business, my career is targeted just for supporting thyroid patients and that community, and I just really enjoy doing it. It's like my mission in life, I feel like. I view my own diagnosis as just a blessing in disguise that kind of led me to serving this population and truly understanding both sides of it, both the patient and the practitioner. So that's where we are today.
Yeah, I love that. So many things you said are so relatable. I feel like the gaslighting of yourself and just kind of convincing yourself your symptoms are normal is so relatable. For myself, as somebody who lives with endometriosis and serves the endometriosis population, I also relate to you as a practitioner in that my personal experience with endometriosis brought me to supporting clients with endometriosis, and there's that personal relatable factor there for sure. I wanted to ask you, because I see this a lot, Alisha, in practice. I see a lot of clients who have optimal, quite good TSH, T3, T4. Sometimes the T4 is a little bit suboptimal, but very, very often I'll see this picture in the labs of nothing off on the thyroid, but then the antibodies will be through the roof. Is this something that you'll often see as well?
Yeah, I see a little bit of everything, but certainly there can be what's called a euthyroid state of the hormones, at least that snapshot in time, right? Which is good to have more data to look at. But yes, you can have normal thyroid function, whether that's with medication, exogenous hormones or not, and still have a strong autoimmune activity, because it can take time, and every case is different. It can take time for the inflammation and damage to the thyroid tissue to then translate into impacting thyroid function or the thyroid gland itself, and then its ability to produce hormones or convert hormones. So yes, and that's where patients really suffer, I feel like, because their blood work looks fine, and then doctors will then tell them there's nothing you should or need to do for the antibodies. That's just a diagnostic marker to say you have Hashimoto's, but it really is so much more than that. Right. But yeah, we do see that pretty often.
Yeah, and I would add too, very often they won't test antibodies if the rest of the panel looks normal, but I see that so often where the thyroid antibodies will be through the roof and the rest of the panel will look normal. Okay, I'm jumping around a little bit here. Maybe we can talk a little bit about some of the signs and symptoms somebody might look out for that might suggest they could have hypothyroidism or hyperthyroidism, which I definitely personally see less often, but there is a little bit of that in the endo population as well. You've already alluded to one, the chronic fatigue, but maybe you can give us a couple of other signs and symptoms to look out for.
Absolutely, yeah. So when we think of what thyroid hormones do, they do have a big impact on your metabolic rate and the health of your metabolism.
Yes.
So that drives a lot of processes in the body. So when I think about the thyroid is impaired, dysfunctional, whether it's hyperactive or underactive, it's either going to drive things up or drive them down. And it can slow down so many things in your body, which is why thyroid symptoms are, head to toe. They affect every cell in the human body in different ways. So yes, fatigue is a big one, your energy production. And then we look at the impact on the metabolism and therefore your ability to lose weight. When it comes to hypothyroidism or weight loss resistance, and then the opposite would be true for hyper when you have excessive thyroid hormones. You can be losing weight without trying, and that can become dangerous too for your muscle mass, your bone health when you start to deteriorate like that. Then we look at things like hair, skin, nails, healing. You might see like dry hair loss, brittle nails, dry skin. Everything is being slowed down and not repaired very well. And then how thyroid hormones also impact your gut. So a really common is constipation, and then from that or with that you see bloating or heartburn, or conditions like SIBO are pretty common. We also have things like, with going back to like energy production, like cold extremities, like freezing. So that's a really common thing with thyroid patients, is they're cold all the time, or they have issues with temperature regulation. So sometimes it's heat intolerance or cold intolerance or both. I hear that really commonly as well, whatever condition you have, hyper or hypothyroidism. And then the other one too that I think is missed sometimes is the mental emotional impact that thyroid hormones have. So thyroid hormones do play very important roles in the brain, but you can see things like depression, anxiety, apathy. I've seen them in myself. I've seen them with most of my clients, and they actually used to use depression as a screening tool to check the thyroid. They don't really do that anymore, and it's probably for many reasons, and it's, depression's on the rise and can be attributed to different things, but they used to use that to screen and then be like, oh, we should check the thyroid to make sure it's not underfunctioning and therefore impacting the brain. Yeah. And the same was true for cholesterol, high cholesterol. So thyroid hormones have a very important role with like liver health, how the liver metabolizes and handles, detoxifies, and cholesterol is one of them. So you can be living a very healthy lifestyle and have high cholesterol. And it wasn't until I addressed my thyroid and my Hashimoto's that my cholesterol normalized. So it wasn't a cholesterol dietary issue. It was a hormonal imbalance, and also my liver being slowed or sluggish or impaired, however you want to describe that. So those are some really, I would say, the main symptoms, and it can be tough too because they do overlap with a lot of other chronic, conditions or situations like perimenopause that women go through. So sometimes it is hard to find a diagnosis clearly when they overlap so much.
Yeah, I agree. You read my mind. I was thinking the same thing. It would be hard to tease that apart. So in that case, then, would you lean in more to labs to get that diagnosis? Is that...
Yeah, definitely labs. I mean, there's a few areas that I look at. I look at family history because there is a genetic connection there for predisposition, and women are much more likely to deal with autoimmunity, thyroid issues, and that's another reason that working with a lot of thyroid patients, I do see conditions like endometriosis, PCOS. They're going to impact women with thyroid disease to a greater degree. I think one study said like up to 40%, I think it was of women with endometriosis are going to deal with, autoimmune thyroid disease conditions. And we can dive into later why that might be or what we think. But so the labs, also a complete thyroid panel is going to be really helpful. Most doctors might just run one, like TSH. But as we mentioned earlier, that can be normal despite autoimmune activity because the body is great at adapting and compensating until it can't. And so TSH can remain normal, and it can take years before we see the thyroid impacted and we start seeing it more clearly on your typical labs like TSH, free T4, free T3. The other thing that we can look into is like imaging, like ultrasound. So we can do a thyroid ultrasound, and that's going to show the size, the texture, the vascularity, if there's nodules or goiters, and that can show like, okay, well, what has physically happened to the thyroid gland that is then maybe impairing its function. I've had patients tell me that their thyroid gland was atrophied, so it's completely shrunken and like not working. And then the opposite can be true in states of acute or chronic inflammation, thyroiditis. So Hashimoto's thyroiditis, inflammation of the thyroid gland, where it can be like swollen or inflamed, or goiters can happen when there's absence of enough iodine to help create thyroid hormones. So yeah, there's a lot of things physically that can be screened. And then the last option is not as common because it is more invasive, but sometimes with Hashimoto's, they may not have those positive thyroid antibodies, TPO, like thyroid peroxidase, thyroglobulin, and you can actually biopsy. If someone is really pursuing a diagnosis or some clarity, you can biopsy the thyroid tissue, and then you can see, I think 10 to 15% of individuals with Hashimoto's may not have those positive blood markers.
Wow.
So then they're again told there's nothing wrong with your thyroid, but if you're really wanting to decipher that, you can pursue the biopsy, but it is not the most comfortable procedure, and it is invasive, but there are options out there if you're really wanting to figure out what's going on with your thyroid specifically.
That's very interesting. I have so many follow-up questions. I don't know what direction to go in. I guess one question, Alisha, because you hear a lot about iodine and thyroid, right? Like with thyroid autoimmunity.
Yeah.
You know, some resources say, to be cautious, not to do too much, right? But then at the same time, you need a reasonable amount of iodine for thyroid function. What is your take on that? Is there, I think there is literature actually, because this is something that I've dove into around iodine, right? And autoimmunity against the thyroid.
Yeah, so where I stand today, and from what I believe to be true and what the research is saying is, yeah, it is definitely a Goldilocks nutrient, where yes, we need some. So the thyroid hormones are produced with using iodine. So if you see like the number by the T, like thyroxine 4, like T4, that is the number of iodine molecules that are attached to that to make that hormone. So there's that context. We don't need that much though. So I believe it's around 52 micrograms daily to then support thyroid function. The iodine is an essential mineral. We cannot create it. We do need to get it from dietary sources. And the leading cause worldwide of hypothyroidism is iodine insufficiency or lack of iodine. That's not the case for developed countries like the United States, so Canada, that type of thing. So especially since they iodize salt, they kind of took care of it. And it is found more excessively too in processed foods and even like personal care products. They can find, iodine. So now it's coming to the point of, well, we're getting excessive amounts, which can exacerbate autoimmune activity towards the thyroid gland. And I've seen it. I have seen it firsthand. It kind of happened to me unknowingly. Like this was at the very start of my journey, and I was recommended to do a high dose of iodine supplement, and I did, and I didn't feel good, so I stopped. I'm glad I listened to my intuition because I could have done more harm than good. I have had clients, same situation, from a functional practitioner who maybe wasn't up to date on what we believe iodine's role is with Hashimoto's, that they recommended a high dose. And I had one client in particular where her TSH, it just shot up so high, and she felt inflamed, and so she also stopped, and things did normalize, thankfully. But we have to be careful, and it does, this is where like the skill and some nuance and experience can all come into play of making sure our recommendations aren't going to do any harm in the long run, because you can. And I do think there's a lot of outdated research that some doctors or practitioners go by of, iodine is good for the thyroid, so therefore more is better. And that's just not the case. So there's also situations of pregnant and breastfeeding women. So yes, we do need more iodine during those times. So it has to be individualized given their circumstances, and make sure it's also monitored as well. So that's kind of my stance with iodine at the moment.
Yeah, I would agree. I'm aligned with you on that for sure. Another thing I was going to ask as a follow-up question from our last kind of theme here is, and this is a big question, so if you don't have like a super concise answer, and you know, we're going to have to be here all day to get a concrete answer. I imagine it is quite similar to endo, other chronic conditions. Do we have an understanding of what's at the root of thyroid autoimmunity or hypothyroidism? I know you mentioned iodine deficiency for hypothyroidism. And then I imagine things like environmental toxins and stress and inflammation are largely at the heart of the thyroid autoimmunity. Is that right? Is there other causes?
Yeah. So you're right. There are many factors at play. So this is how I kind of explain it, because I do get asked that question, you know, from clients too, like, well, why do I have this? You know, and I've asked that question too, like, why me? Why did it develop in my body, not someone else's, right? So for the theory, what we believe to drive autoimmunity, or at least what I was taught, was 3 factors. So genetics is one. You have to have the genetics, you know, to develop a condition, which is why we all don't develop the same chronic disease if it's going to happen. So genetic predisposition. Another one is the health and integrity of your gut, which is a very central system in the body that needs to be in balance, especially for chronic illnesses, but I'd argue everything. And then the third is outward stressors, and this is where it can be a huge, you know, list, a very long list of many different factors. And on top of that, it's individualized. We all don't have the same stressors, but when we think about our modern way of living and the stressors that our environment now, not one person isn't, you know, overloaded with chemicals and toxins, and, you know, so we have to be realistic about that, and we can only control so much when it comes to what do we do about it, and we can dive into that. But, you know, stressors can be everything from trauma, childhood events, you know, ongoing stress that your nervous system was never able to switch out of or handle, and then there are other things. Let me list them first. There are, you know, viral, bacterial, chronic infections that are overstimulating the immune system. And really, I think what's helped me is understanding that autoimmunity isn't your body just attacking itself. I think that's a very poor way to view it. I'm now at the understanding that our body is looking for safety. It's trying to protect us, but it can backfire, obviously, when we are overburdened with, whether, again, it's bacterial, viral, mental, emotional stress, you know, chemicals, toxins, and then our body isn't able to handle those things as well as it could. And that can come down to missing vital nutrients, essential nutrients. It can be, you know, things that are standing in the way from natural healing to occur. You know, we don't have to tell our body to heal, it just does it. So that is innate and natural in us, but there are things that are going to inhibit that from happening that are what we like to take a closer look at, again, with what we can control. So there's so many things, and I really do feel like, too, and since women are much more at a higher risk for autoimmunity, and it can come down to theories of how our immune systems are different, as well as our hormonal profile is very different compared to men. So like that is going to make us more vulnerable too. And I think also just our stress, the way we handle and perceive and deal with stress as women versus men, I believe is different too. So those are, lots of different factors, but we definitely see common themes, like I mentioned, genetic, gut health, and then finding out the personal stressors do take a little bit more time, but thankfully, and I know we're going to talk about this, there are things that almost everyone could benefit from, despite your situation, to help your body, you know, lessen that burden, be able to handle whatever stressors there are better, so it can get more to a place of balance, and it can help the immune system, you know, be regulated better. So that's the good news, is like, yes, it can be confusing to find your root cause sometimes, but you can address them, and you can get to a better place, and you can reverse your symptoms.
Yeah, that's a nice message of hope. Maybe we can talk about some of those things. I guess, maybe we can talk about some of those things, and I can circle back to some of the other questions. But yeah, what are some things within our control to improve autoimmunity needs the thyroid, or, to normalize the labs? It's a very big question.
Yeah. Yeah, I like to speak from my personal story too, because I do feel like it was, again, hindsight is 2020, but it was so helpful for me to really see these turning points in my life and in my health journey that actually made a difference, because I did try a lot of things, that I thought were gonna just, okay, I'll take these few supplements, or I'll just go on this diet, and then I wondered why I didn't have this immediate success and healing, So for me, I think it kind of goes back to after my diagnosis, when I knew I had the condition, but I still wasn't sure exactly how to manage it well. I had a very stressful period in my life, and that's when my weight was the highest. I was the most inflamed, and I felt my worst after being on thyroid medication, which I do think was important for me and needed. But the amount of emotional and mental stress I had really just pushed my body into a place of, I cannot handle this. My immune system was, even more imbalanced. And then when I realized, okay, I really do need to figure out how to manage my past and present stress better, because it is not doing me any favors for my physical health. I do believe, the body keeps the score type of mentality. It is going to manifest physically, whether you are conscious of it or not. Yeah. End of story. Right. And I think sometimes it comes down to, like, until it happens to you, you may not be on board with that line of thought, and that's okay. Sometimes you have to go through it to, like, understand and see more clearly what's happening. But all of that stress going on in my life helped me shift what I was doing and my approach. So instead of, I'm just gonna, dig my heels in deeper and work out harder and be more restrictive with my diet. And, that's what a lot of people are told to do, because they might want to lose weight or be healthier, right? So they just dig their heels in and do it harder. That is more stress to the body, and stress is relative to your situation. It's in the context of you. So for me, I needed to eat more and nourish my body and relax a little bit with my diet. I needed to sleep more and allow myself to rest without feeling guilty. That's a hard one for women, I know. A lot of my clients say the same thing. I needed to ease up on my exercise and do movement that I enjoyed that was gentle. I needed to get outside more, which I did. I did lots of walking in the park near my home at the time. I needed to work on my personal boundaries and relationships that weren't serving me at the time, and I needed to really protect my mental, my well-being. And that's hard, with my personality and temperament. That's a hard thing for me to do, is speak up for myself and draw some boundaries. But practicing that was very, I believe, therapeutic for myself. There was also, like, spiritual health too. I mean, there's so much that goes into play, and for me too, like my relationship with God and my faith, that really helped me through, because you can't control everything. And I think I was trying really hard to control a situation that was not really fully in my hands. And so it was that year, and then it was also that year that I met my husband, my now husband. So, like, things did turn around wonderfully, thankfully. And two, now being where I'm at, the safety of a good relationship and learning more about myself and understanding the habits that I personally need on a daily basis to maintain my health and maintain more balance. It's a learning process that you do have to go through, but I understand it's very helpful to have someone be like, hey, like, here's what we know can help a lot, and you don't have to resort to extremes. And these small habits do compound over time and result in healing. They do. And I think a lot of people think, these small things aren't going to make a huge difference. Like, it doesn't really matter. So some of those other things would be like what you're eating every day, right? Look at the habits, look at your daily habits. You can absolutely use food as medicine. And when it comes to inflammatory conditions like endometriosis, autoimmunity, thyroid disease, we're looking at, we're pretty depleted in that antioxidant pool. Our body is using them up more rapidly. So we're looking at, well, how can we use the foods that we eat to be anti-inflammatory, not pro-inflammatory? So an anti-inflammatory diet is and eating enough, which I can't stress enough to women listening, because I've been in that, I'm just going to eat as little as possible, you know, and it is probably the worst thing that you can do if you're trying to support thyroid health. I'm sure endometriosis as well. You can't starve your body. You can't deplete yourself of nutrients by not eating enough. So anti-inflammatory foods, colorful plant foods. I mean, there's a lot. We could even just speak on nutrition. So let me know how deep you want to dive there.
Yeah. No, I mean, that's great. I mean, oily fish, nuts and seeds, olive oil. Yeah, I mean, we don't have to go too deep into that.
Yeah.
I think what you have a lot of great resources that are people can refer to. Yeah.
But, you know, every day making that conscious effort of, okay, I'm going to spend some time prepping my food so I'm not accidentally skipping a meal. I do that a lot too. And I'm going to make sure, like, hey, I'm going to ease off of maybe a specific food sensitivity or trigger that I think is causing some issues. Like, let's just observe and see what happens. It doesn't have to be all or nothing. It's progress over perfection. I say this all the time, like, and that's a hard mindset sometimes for people to like unlearn that perfectionist mentality and get on board with like, I'm just going to do my best a little bit each day.
Yeah.
It's going to be a lot of gray before you have it figured out. And that's normal. Like that's part of it. That's part of you learning your body. That's part of you learning how to care for it. So kind of embracing that and leaning into it has been really helpful for me. We can talk about, I mean, there's gut health,
a lot. I know it's
detox pathways. Yeah, there's so many things that you can work on, just, you know, that are more general, but will help, like I said, will help almost anyone in this position of endometriosis, you know, autoimmune thyroid disease.
Yeah, I agree. I think gut is a big one, as you alluded to previously. You know, it's the epicenter of health. It's a big site of thyroid hormone conversion. It could be a major site of inflammation. So I think it's huge. I did want to ask, because this is something, and I noticed you did have some content on this topic as well, but you hear a lot about like gluten removal and the molecular mimicry that happens with that. I'd be curious about your thoughts, your informed thoughts on gluten removal for Hashimoto's and or dairy. Like, how important is it?
Yeah, so I like this question.
I know, not easy.
Yeah.
There's so many caveats.
Right, that's exactly right. And it is another one that every day people are like, just tell me what I need to do. Do I need to cut it out? And honestly, you know, most of the time I want to just be like, I don't know, because I don't, you know, I don't know everything. I don't know every situation. However, usually what I encourage people to do, because there is some level of responsibility, exploration, curiosity, trial and error that comes with figuring out your health that only you can do. So a lot of times my response is, yes, I believe for most people with autoimmunity in general would benefit from just removing it and let your body do the talking, let your body give you the answers. And I've had many clients where I'm like, hey, just do it for a week or 2 weeks. Like, let's do it to whatever level you're agreeable to be consistent with, and report back to me. Let me know. I know it, you know, anyone, you can do it for a week or two. I know it seems really hard at first because it is a big dietary shift for a lot of people. But I had this one woman, I remember, she had Hashimoto's for like 20 years, something like that, most of her life, or at least half of her life. And she had never considered or thought to cut out gluten because she was like, well, I don't have any symptoms. So like, it's fine to keep in my diet, was her logic, and I think a lot of people's reasoning. So I was like, hey, let's just try. I've heard some crazy things when people go off of it. I'd be curious to see like what your personal experience is. And she did, and not but a week and a half later, she emailed me and she was like, I can actually fit my wedding ring on my finger. I had been so swollen and not really realized why, but the inflammation in her hands, the water retention had gone down, and she was so grateful that it was that one switch that led her to figure out, okay, well, in some way my body is reacting to gluten. The other thing to remember is, especially with Hashimoto's, and I'm not sure about the stats on endometriosis, but celiac, there is an overlap with genetic risk. So there are some shared genes, and even if you don't have maybe celiac per se, you can have non-celiac gluten sensitivity, which I also see quite often, that it is this, you know, headaches, inflammation, brain fog, fatigue, but then also, of course, maybe, you know, digestive distress in some way. that sometimes people notice immediately within the first week. Other times it takes a little bit longer, but it can absolutely take time because it's not just gluten in your diet that can lead to feeling better. It can be other aspects of your diet that need to be worked on.
Yeah.
But I'm just in the camp of, look, you are the master of your own body. You know it best. So just try it out. And same with dairy. I mean, for dairy too, there's a lot of adults who are lactose intolerant. So they're not fully, like, the symptoms aren't so bad, so they'll just keep eating it and just deal with it.
Yeah.
Or, because it's not a food allergy where they're having like an extreme reaction and they enjoy that food. But again, if you're lactose intolerant, that can influence medication absorption or TSH levels too, and also cause discomfort and potentially other issues with your gut health. So I think it's worth experimenting. Maybe you just need to be on low lactose. Maybe it's just lower dairy or certain types of dairy. So there isn't a straightforward answer. It really is just exploring either by yourself or with a skilled practitioner, dietitian who can guide you and maybe make the process less stressful and just easier, because they're kind of telling you, what to focus on and what to be aware of.
Yeah, I totally agree. And there is an overlap also with celiac disease and endometriosis. So I try and be as non-restrictive as possible, because I don't know if it's the case in the thyroid space, but there is a lot of like disordered eating, a lot of food fear in the endometriosis space. So I try and be very mindful of that. But I definitely think it's worth pulling out. And the thing that I always say too is, like, if you look at your diet now, maybe this doesn't apply to everybody, but if you look at your diet now, like, what are those sources of gluten? Because by going gluten-free, are you going to inadvertently pull out like all those processed muffins and white breads and things that maybe you shouldn't be eating
Alcohol,
anyway?
yes.
Right, like
100%.
Whether or not you have endo or Hashimoto's or sluggish thyroid function or some other autoimmune condition, like, these are not really foods that should be taking a central place in our diet, really. So that's like a big thing that I kind of, say to people. Maybe if you're not super keen on fully pulling out gluten, maybe just try those whole food sources. Like, let's get some barley in there, some spelt, see how you do with those. But certainly in the case of like the molecular mimicry, the genetic overlap, you might just want to consider like fully pulling out the gluten, right? Okay, so this is another really big question. It's a big question. And we've kind of already talked a little bit about it throughout our conversation. There's been like little, nuggets thrown in response to this question already. But the question is how thyroid concerns, hypothyroidism, Hashimoto's, how they overlap with endometriosis. So there's a couple things. I mean, you just talked about sort of the genetic link. We know that you're more likely to have something like celiac disease or Hashimoto's or other autoimmune conditions with endometriosis. So that's one way it overlaps. We've talked about the importance of gut health. That's huge. We can certainly dig into that a little bit more if we have some time. Maybe we can talk a little bit more about the relevance of the gut. Maybe hormones. Are there hormonal hormones involved? Like, I know that high estrogen can make it a little bit trickier for thyroid hormone conversion to happen optimally. So as much as maybe we can get in here, some of the overlaps there, and I can kind of chime in on the endo side.
Absolutely. So you're right. Gut health, that's one core area I focus on with my clients, and it's rare that I find someone who doesn't have something that needs to be improved. But I definitely see a lot of common themes, whether that be dysbiosis, slowed motility, low stomach acid, SIBO, constipation, and that in turn will affect how well you are removing estrogen from the body. If you are constipated, it will remain in the body, potentially recirculate and cause issues. So having a functioning, your drainage pathways open, which is regular bowel movements, that's really important. And the thyroid, its role, again, think of it slowing everything down, including peristalsis and how well things are moving through your gut. And then, it can lead to things like I mentioned, SIBO, like small intestinal bacterial overgrowth, and that can, trigger the immune system and cause a lot of symptoms and digestive issues. But and then you can have gut inflammation from endometriosis that can also impair nutrient absorption. and then also worsen your thyroid function, because we do need a lot of trace minerals and nutrients to optimize, I would argue, all of our hormones do require certain building blocks. And then the whole being able to remove estrogen is a big one, which is both with your gut health and also how well your liver is functioning and how well you have your, the different phases of detoxification are operating. Glucuronidation, methylation, and it's kind of like chicken or the egg. I know a lot of these individuals genetically might have poor methylation activity, certain gene mutations that feed into that, or they're missing things from their diet that can help the process, nutrients, protein, whatever it may be. So again, it is this two-way street that can absolutely feed into one another, but gut health is a great place to start because it also kind of pushes you to work on your nutrition, since nutrition has such a large impact on gut health and vice versa. So that's why I do, like I said, start there with my one-to-one clients is let's investigate gut health and optimize that along with your nutrition. But yeah, then with hormones, thyroid hormones do affect ovulation, progesterone levels, and then estrogen clearance, like I already mentioned. So this is where we also see fertility issues with thyroid patients. Is these suboptimal, and then you throw in Hashimoto's with inflammation and higher risk of miscarriage as well. But optimizing thyroid, hormones are so important for conceiving, for the health of the baby and mom during pregnancy, postpartum, all of that. And so a slow thyroid then affects estrogen detoxification, and that is going to then worsen endometriosis and endometriosis symptoms too. So that's kind of the relationship we see with thyroid on like the sex hormones, and then that overlap with endometriosis.
Yeah, lots of, sounds like a lot of vicious cycles, right? Hypothyroidism causing sluggish digestion, which can then cause delays in elimination not just of waste, but also maybe endocrine disrupting chemicals or toxins that are making their way into your body that can also complicate the thyroid function, but then also estrogen elimination. And then thyroid dysfunction can also affect hormone production. Like if it's sluggish enough, would you see low levels, high levels? I suppose you can see either, right? That could be a root cause for hormone, like suboptimal hormones. Yep. And then what would you say? I have kind of like a couple of vitamins and minerals, electrolytes that I like to focus on with patients who have sort of an overlap with endo and hypothyroidism or Hashimoto's. Do you have like, and just to preface, okay, because there's so many caveats to this, and we've already established that a lot of the foundations are super important: the sleep, the stress management, the emotional side, the spiritual side, good nutrition, anti-inflammatory. But do you have sort of like top nutrients that you focus on that you think are like exceptionally important when it comes to the thyroid? We've talked about iodine.
Yes. Yeah. When it comes to, and I base mine off of history, symptoms, lab work, I get a good picture of what someone's going through, but I absolutely see patterns. Yeah. A lot of times it's low D3, low vitamin D3. It's needing, whether it's elevated homocysteine or low B vitamins, like methylated B complex can be really helpful. That's kind of speaking back to like methylation issues. Some of these minerals like zinc and selenium, and that can come from both not getting it from your diet, and then not, if you do have gut issues, not absorbing those nutrients very well, which we do see again with like low stomach acid or slower motility, SIBO, things like that. So you have to, one, get it from your diet, and two, absorb it from your diet for your body to be able to use it. Magnesium is another one that I absolutely love for stress, sleep, recovery, inflammation. That's another nutrient that's, it's needed in so many areas in the body to a high degree, but it's also depleted from stress, especially like, if there's like really high cortisol levels from chronic stress. And another one that a lot of times, even if you are eating magnesium-rich foods like pumpkin seeds and dark leafy greens and avocado and dark chocolate and all of that, which I love all of those foods. I try to incorporate them into my diet regularly, but I even tell my clients, I'm like, I still supplement. I do topical magnesium, Epsom salt baths. Like, it's something that most people can benefit from having a more therapeutic dose when you're dealing with chronic inflammation or chronic stress. So magnesium, and also that can help with improving vitamin D3 levels. It's not just, not just asking why is it low, or that it's low and replace it. It's why is it low too. There's many other factors that can drive down vitamin D3. Yes, yeah, exactly. And fat malabsorption if you have liver or bile issues, which is another common thing with thyroid patients. So yeah, those I would say. And then I also really like using things like cod liver oil or omega-3s with like retinol, like active vitamin A that's usable. Like that can be another one for cellular health of thyroid hormone reception. Potassium is a great one too. Talking about like replacing minerals, like sodium and potassium in balance is really helpful for like energy and brain fog and just cellular energy. So those I would say are some common ones that most of my clients are getting both from either their nutrition, their diet, or focusing on those foods, and also like filling the gaps with supplements that maybe they can't or are not able to get enough from nutritionally in their diets.
Or they're not absorbing super well because of some of those underlying conditions that we talked about, like SIBO or the fat malabsorption. Okay, awesome. Do you have a favorite book on the thyroid, the topic of the thyroid or autoimmunity?
Ooh, yeah, I've read quite a few. Dr. Isabella Wentz has some great, she's the thyroid pharmacist, some great books, cookbooks, great place to start. That's where I started with my personal journey, because she was like one of the main resources at the time. There's a newer one that I've been reading on and off called The Thyroid Debacle. That's a really nice, do you have it? That's a good one. It's a
love
really,
that book.
yes, very comprehensive approach. I believe it was written by a medical doctor and a chiropractor who both struggle with thyroid disease. Yes, there it is. I have it on my desk too.
Have it? Yeah, Eric Balcavage and Kelly Halderman. Yeah, you can see all my like.
Yeah, me too. Mine's like highlighted and like
so good.
Yeah, very. If you're really interested in like the whole body approach, they go over like interpreting lab work and getting to root issues. And again, it is this holistic approach that is going to help you achieve that balance and reverse those symptoms. It can't just be one or two things. You really do need to take, and I always say this too, an honest inventory of your life and lifestyle and see where you could improve. But that's a great one. If you want to learn more about the iodine connection, there's a Thyroid Diet Reset by Dr. Alan Christensen. That's a pretty new book too, and he shows a lot of research about like, okay, well, iodine, what do you do? how do you therapeutically adjust it in your diet? And here's the research that says it can help with getting into remission if iodine is a root issue for you, excessive iodine. So yeah, those are probably my top ones. I'm sure there's certainly some more, but.
Awesome, thank you. What was the iodine book called?
The Thyroid Diet Reset.
The Thyroid Diet Reset?
I'm pretty sure.
Okay, cool.
You can check me there, but yes.
All right, awesome. Do you have any final words of wisdom, tips, resources? I mean, you're a resource. We'll link to your socials and your website in the show notes, but any final tips, words of support, or anything that we should end off with?
Yeah, a few. I mean, it's never too late to reclaim your health and improve. I know some people think it is because they've had a condition for a really long time and they haven't made maybe much progress. But, it really does come down to it's a transformation. You should look like a very different person inside and out in your behaviors by the time you get to that place where your condition is more managed, because you will slowly transform, and this is true for me. There's a lot of things in my life I had to work on, to unlearn, to relearn, and in practice, truly, like certain things are a skill. Good nutrition is a skill that you need to learn and practice. It's not just head knowledge and then translated effortlessly into your life. I wish it were that easy, but you can apply that to everything. The right movement for your body, practicing like setting boundaries and your psychological and mental health. That's really, really, really important for autoimmunity. And it is, the whole atomic habits approach. Like it's small things day in and day out that you are willing to do, that you can be consistent with. And the other thing is you can't do all of it at once. A lot of people try, especially when they're super motivated in the beginning. They're like, great, I'm going to do this thing, this 30-day challenge, this 3-month thing, 75 hard, whatever it is. But they don't have that intrinsic, value or motivator or purpose of why they want to change in the first place. And it really does have to come from you, and it has to come from a place of responsibility and purpose and truly wanting to change. And everyone has their own pace. That's fine. But if you want it to stick, these habits should be things that you want to do for the rest of your life. It's not just until you feel better. Unfortunately, it doesn't work like that. I'm going to do this for my health. I'm going to fall in love with the process. It's not about the outcomes or destination, because when you fall in love with the process and these habits that you're building, the outcomes will come in time, I promise. Whether that be weight loss, whether that be more energy, whether that, whatever your goals are. But people get so fixated on the outcomes that they don't actually build up the strong habits to get there, and then they never get there. And a lot of times people have to learn that the hard way. They do everything else, it doesn't work, and then they finally all right, I'm just gonna, I gotta commit to myself. I have to work on my discipline. I have to get a support system or hire a practitioner or invest in my health. And usually it's when people get to that point that we see a lot of success, that they've figured out the formula for them to truly start healing and being in alignment with their body and having that awareness and creating their own wisdom, if you want to, say it that way. But that's kind of what I see and has worked with what's happened in my own life. And then when I see with my most successful clients is they have that deep reason to change. Their why is very, very powerful, and it carries them through the highs, through the lows. And then at the end of it, they're transformed into a completely different person, and they're feeling their best again. So
yeah, I love that. And I would 100% agree. I always tell people, you didn't get where you are today overnight. And so in order for you to get to a place of this wellness where you're feeling good, it's being reflected in blood work, it's being reflected in your energy and your fertility. It's going to take some time, right? It's a process. So I 100% agree. And I think that that's a very nice and positive way to end off our chat. Okay, great. Well, thank you, Alisha. I'm just going to end it there, I think. So thank you so much for your time today and for sharing your wisdom with us.
Yeah, my pleasure. I'm very happy to be here, and hopefully I can help anyone dealing with both thyroid issues and endometriosis, because those are some really, really tricky ones to navigate. But yes, message of hope, message of healing. There is support out there. We are both, examples of that, but there are more, and you can get there.
I agree. Thank you so much for tuning in to today's interview. If you haven't already, give this video a like, share it with a friend, and hit that subscribe button if you haven't already, and I will see you in the next video.